Hi, this is Jen. Welcome to another episode of My Autoimmune Path. Hope you're doing well. So, on this episode, I want to discuss being your own advocate. So, what in the world does that mean? Well, in your health journey, you really are going to need to be your own advocate. You know, when you think about it, you're the one that was or is diagnosed. You're the one who has the condition, and it is your journey, it's your path. And while family members are there to help, or friends are there to possibly help, and healthcare practitioners are there to help, at the end of the day, you need to be your own advocate. So, I want to discuss being your own advocate in three ways. So, the first way is in your diagnosis. Now, I will say that most of the time, you're probably going to find that getting the diagnosis is the easiest part of the puzzle or easiest part of the journey, because you've most likely been having symptoms. You've most likely been having them for, a substantial period of time, whether it's, say, 6 months or a year. I know in my case, I was having symptoms for about a year before I was diagnosed. And I actually heard a statistic one time in a Crohn's and colitis support group meeting that is an average time frame of someone living with inflammatory bowel disease. And they usually live with those symptoms for about a year before they're actually diagnosed. And so I just thought that was kind of ironic that was definitely the case with me. But if you've got a lot of symptoms going on, it's not that difficult to get diagnosed. Now, sometimes it is, but like in my case, there were very specific tests that could be done to give us that result, right? They did the sigmoidoscopy on me and took some biopsies in, my colon, from my colon. And then I don't know how they do it or did it back then, it was sent off to some kind of a lab, and I guess they looked at cells under the microscope or whatever. But it gave us some answers. And a lot of these diseases, do have very sort of definitive symptoms and characteristics. And so, it's an unfortunate thing to be super sick. It was a horrible thing in my case, but, the doctors are usually able to tell you what you're dealing with. But there are times when it may not be that easy. Maybe your symptoms are pretty vague, or and I've heard of this with Sjogren's syndrome. Sometimes people can have Sjogren's syndrome or Sjogren's disease, but then they don't get, the lab work doesn't show that they do. And what's difficult is, in some instances, the lab work will show definitive Sjogren's, and I think it's like the ANA test for that, but you don't always get it on your blood work, and sometimes it has to just be diagnosed by symptoms, and not every doctor is going to want to diagnose just by symptoms. So that can be a tough thing. and you need to keep kind of pressing and just insisting, on trying to look further and get some answers and everything. And um, also, sometimes doctors just kind of give up. They just kind of give up on the patient for whatever reason. And that happened with our son. He was having some gut issues. He doesn't have the same condition that I have. He has IBS and I have IBD. But this was when we were living in Texas. And so I encouraged him to go see a GI doctor. And then the GI doctor wanted to schedule a colonoscopy. And so I actually flew home and went with him that day. It was his driver and all. And I remember after it was over, the doctor said, "Well, everything looks pretty normal." And we thought, okay, well then. And I said, "Okay, well, what is going on? What is causing these symptoms?" And he said, I'm not really sure, It was just kind of this awkward thing of thinking, are you kidding me? Like, I flew home to come be with our son for this test, this very expensive, very invasive test, and you're not giving us anything to go on? Like, what in the world is this? So thankfully, we got the idea. My husband and I got the idea to take our son to a doctor who he's really more my husband's GP. And I've seen him a few times too through the years, and he's always been very good to us. But we took him and said, listen, this has been our experience. He had a colonoscopy. There were really no conclusive answers. The doctor didn't even give us any kind of direction, like what are the next steps to finding out what's going on. And so thankfully, he said, well, let me do an x-ray. So we did an x-ray of our son, of his gut area, his intestines and all that. And within about 5 minutes of him having that x-ray, he came back in the exam room and said, okay, you've got IBS with XYZ sort of conditions. I guess you can kind of lean towards diarrhea with it, or you can lean towards constipation with it. And I don't honestly remember which one he said, but he, from that x-ray, was able to say, hey, this is what you're dealing with. And I just cannot tell you what that felt like, because our son he finally had some answers, and it's always kind of this double-edged sword. Like, you don't want to be diagnosed with anything, do you really? But if you've been dealing with symptoms and struggling with not feeling well, my goodness, sometimes it is just a huge relief to finally get those answers, to be validated that, yes, you have something for sure. And, it's not just this sort of, I don't know thing. And boy, it did our son so much good just to know. And so let that just be kind of, I guess, an example of, if you go through a lot of testing and you do what you think you're supposed to be doing, and you don't get any answers, just keep going. And that can be hard. You don't always maybe know who to see or whatever, but just, ask around, talk to friends and family. And usually somebody will have a good physician to recommend who has more the mindset of yeah, we're going to get to the bottom of this. We're going to keep looking until we get some answers. We're going to figure this out for you, you know. Sometimes maybe they're the older doctors or the older school kind of doctors. You know, I don't know what it might look like in your particular situation, but if a doctor just kind of comes up with the shrugged shoulders and I don't know, don't let that be the end. I would just encourage you to keep pursuing, because a lot of times there is something going on. You just got to keep digging for it. So the number 2 is um, being your own advocate in getting a treatment plan. Now, a lot of doctors or healthcare practitioners are going to want to put you on, you know, standard protocol type stuff, which I'm not saying there's anything wrong with standard protocol type stuff. I would encourage you, before you just say, okay, sure, great, find out what the options are. And they may be pushing you towards one particular thing. And that might be a real scary drug that has a black box warning, you know? And that might be what you need, depending on your situation and how sick you are and all of this stuff. But look, y'all, it's not like that doctors are over here and they're just the gatekeepers of all the information. Now, maybe sometimes they do gatekeep or want to gatekeep, but there is information out there in the world. And I'm not saying that we like look at Dr. Google for all the answers and things like that, but there's a lot of ways to get information these days, y'all. You have to do research. I mean, if you've been sick for a long time and then you finally get diagnosed, sure, you want to probably get on some kind of a treatment plan or a medication because you want to feel better, right? I mean, who wouldn't? You don't always have to just take or do the first option that's presented to you. I would just encourage you to be your own advocate in doing your own research, finding out about these particular medicines, asking lots and lots of questions to your doctor, and then saying, hey, can I take some time and think about this? If maybe you don't feel a huge peace about just jumping into something with both feet. Sometimes doctors are open to that, sometimes they're not. It just depends. And if you have a doctor who, and let me just say this in as diplomatic way as I can, but if you have a doctor who just is emphatic that, you know, it's their way or the highway, you know, there's other options out there. You can get a second or third opinion. Do your research and just try to feel really at peace and comfortable with whatever your treatment plan is. Like, for instance, those years ago after I was diagnosed with ulcerative colitis, and my physician gave me 2 options. And I'm thankful he at least gave me 2. You know, he could have just given me 1, which that would have been really hard. So it is really good when you have options. But he said you can either take prednisone steroid, which are those corticosteroids, or you can start on a medicine called Asacol. You know, and he kind of told me about both options. And I chose the Asacol. And I felt very much at peace about that. And thankfully it worked for me. You know, you are the patient, and you need to feel autonomy. And it's not that you've been to medical school and you have all the answers. I mean, yes, their education and their knowledge base is absolutely valuable. I mean, it's why they're doctors. And not all of us can be doctors. But at the same time, I would just say it's good to have somebody who you feel like is a kind person and who cares about you as a patient, and not just that you're not just a number or a name, or a way to make money. If you don't feel that way, then maybe you need to find somebody else. And I get it. It's not always the easiest thing, or maybe you don't feel like you have a whole lot of options. But whatever your treatment plan is, try to just get to a place with it that you feel like, yeah, this is good. And look, we don't always know how it's going to go. Sometimes you might get on a medicine and it might be a dumpster fire and you have to scrap that. Maybe you get some crazy side effects, or it's just not helping. And then you go again. You say, okay, what's next? My doctor had prescribed me something similar to Restasis. It was, I think, the generic version of Restasis last year, kind of at the end of the year. And I had gone ahead and picked it up from the pharmacy. But before I started on it, I thought, I got to research this a little bit more. I got to kind of understand what this medication is. And when I researched it, it just wasn't something that really seemed to be my style. Like it's a chemical. It's basically chemicals. I mean, I don't know. I can't give you the chemical makeup of that medication, but it's sort of almost like a chemotherapy, and I just could not kind of wrap my head around or get a piece about putting that in my eyeballs, And so I never started on it. And then several months later, which was, I guess it was maybe at least 6 months later, but when I saw him again, we discussed how I felt about it. And I had asked, give me your honest assessment. How successful is this for your patients? And he said, it can vary, but it wasn't this like overwhelming success. It wasn't like he was saying, oh my gosh, it's 90% of my patients do great on this. No, that was not it at all. And so then at that point, he said, well, we absolutely still need to figure something out for your dry eyes. And I said, yes, we sure do. But then he thought to bring up the autologous serum eye drops and asked me if I had ever heard of them and if I'd be willing to try that. And I had heard of them, and I said, absolutely, yes, I'd be willing to try them. So sometimes, and you gotta do it in a respectful way, because your doctor, I mean, look, y'all, they go through a lot. They go through a lot to become doctors. They go through medical school and residency and sometimes a fellowship. And it's a real grind, it's a real slog. You don't want to come in there and act like you have all the answers, because if you're not a doctor, then how would you? So be respectful, but it is okay to ask questions and try to get the information that you need to feel comfortable. And then if nothing resonates with you, say, well, what else? What else can we do? Like, just keep asking that, because they have a lot of tools in their toolkit, and they may lean on certain ones. They may be tempted to just pull the same 2 or 3 out, but those 2 or 3, while they might work for a lot of people, aren't going to work for everybody. So you got to find the best fit, or try to find the best fit for you as a patient. And again, you are the patient. You are the one living with this disease in your body. It's an autoimmune disease. Your body is fighting itself. It's just good for you to feel like you have autonomy in making that decision about what your treatment plan is going to be, what we're going to use, and how we're going to use things to manage the disease, so that you can, have the best quality of life possible. And then, y'all, there's the whole sort of other concept of getting to the root cause, which that's a more functional medicine approach. And a lot of allopathic doctors don't subscribe to that the way they've been trained. And there's nothing wrong with this, it's just different approaches. But the way they look at it is that they manage the disease, they manage the symptoms through medicine primarily. A functional medicine practitioner, and I'm not saying they're perfect either, they may have some faults, but as much as possible, they want to sort of pull back the curtains or dig down in the layers and say, okay, what is causing this? You're having some weird, rashy, itchy stuff. Let's not just treat the skin topically. Let's figure out why your body's doing this and what's going on. And a lot of times, y'all, it takes a lot of digging, it takes a lot of testing. In that kind of instance, it might take testing for parasites or viruses or bacteria, or just to see if your detox pathways are working, all kinds of things. It's basically saying, we're not just going to put a Band-Aid on this. We're going to keep digging until we get to the root cause of why. And so that's an approach that really resonates with me. Unfortunately, at least in my area, there are not a lot of practitioners who do that. You may be fortunate to live in an area of the country where that's more prevalent. And if you do, I would be thankful to have that option. And sometimes we need all of it. Sometimes we need to have our functional practitioner and we need our allopathic physician as well. And they can hopefully kind of all work in tandem. In getting a treatment plan, just do not forget that you have some say-so as the patient. It's your body. Those medicines are going to go in your body and affect your organs and your cells, and you have a say-so. So this is kind of like the number two. The number two is getting on a treatment plan, right? But then the number three is more kind of like the long-term view. So it kind of goes diagnosis, getting on a treatment plan, which actually that treatment plan can be a number of things through the years. You're not necessarily always going to stay on that treatment plan. But then the third one is just this sort of lifelong managing of your disease or your symptoms, which, yes, that sounds very allopathic. That sounds like, something that traditional medical doctors would say. But I guess it's just more about being an advocate in living with this for the rest of your life. All those years ago when I was diagnosed, I was told on the phone, you're going to have this for the rest of your life. And for most of us, unfortunately, we will. We will probably have to live with whatever this condition is you've been diagnosed with. A lot of this is kind of on you, that it's like not up to you to know everything, but you got to remember nobody's gonna make the decision about what you eat and what you drink and how much you sleep and how you manage your stress. And so you got to really take ownership. And that's probably the best way I can say number three, is just that you get to the point where you take ownership of living with your condition. And you say, I'm not going to be a victim. I'm not going to say, woe is me. I'm not going to just get down in the dumps all the time about this. I'm going to figure out some things. I'm going to try some things. I'm going to, work on my sleep habits. I'm going to work on my hydration. I'm going to pray through this more. Let the Lord be my comfort and my guide in this, and just don't be looking to the people in the white coats to always provide you what you need. They have a certain amount to offer, but they can only offer the tools in their toolkit and, what they've been educated in. And they have not been educated in everything. Do you all know that most physicians, most allopathic medical doctors have a very minimal training in their medical school experience on nutrition. And most of that is geared around, say, deficiencies, like for an example, in the case of, say, scurvy, and that's a deficiency of vitamin C. So they just, that's not, it's just kind of not in their wheelhouse. There's not, I guess, really why they went to medical school, and hopefully some of that is changing these days. I remember asking when I was diagnosed about things to eat, and I said, what should I eat or what should I not eat? And I was told, doesn't really matter. Well, sitting here now, 30 years after being diagnosed, that just sounds like the craziest thing I've ever heard of, Like, if you have a gut condition, of course it matters what you eat. And even if you don't have a gut condition, even if you had some kind of a muscle condition or a bone condition or whatever, y'all, why wouldn't it matter what you eat, So, but again, they're not trained in that a lot of times, and they don't take that approach. Just realize at the end of the day that, it's going to be up to you to get the exercise you need, get the rest you need, the hydration you need, figure out supplements that may work for you. Do your own research about that, and just, figure out what might help you. But, doctors, they get what, 10, maybe 15 minutes at most sometimes with a patient. You just cannot look to them for all of the answers. A lot of that just needs to come from you, where you say, I'm going to pick myself up, and I'm just going to figure some things out, and this is my journey, and I'm going to own it. So I hope that makes sense. It's certainly something that I have had, to kind of come to terms with over the years. Like, I finally just realized, okay, a lot of this is on me. Not in the sense that, I'm going to prescribe myself medicines or anything like that, but it's more of like an attitude or a perspective, where you just say, they'll do what they can do, and I've got to do what I can do. And I can do a lot, You want to empower yourself in that way, and just remember that there's a lot that you can do in the choices that you make. So, all right. Well, I hope that helps. And if you have anything to add, please comment. And also, please like and subscribe, because my channel is growing and it's exciting. And I'm really glad that the word's getting out. And it's just my prayer that doing these videos can be helpful to people, so that you know that you're not alone, and that we're out here dealing with similar type things. We may not go through the exact kind of diagnosis or condition, and that's okay, but that this can be a community. So thank you so much for watching. Catch you later. Bye.